let's just take a quick review here. So the first thing I want to talk about is our starting position. Anytime we're doing anything in kinesiology or with the body, we need our frame of reference. So if you all can join me, if that's possible, based on your environment. What I ask is just everyone go ahead and get in anatomical position. So as a quick review for anatomical position, what we're talking about is standing up. Our feet are going to be about our shoulder width apart. We're going to have our palms facing forward. All right, so this is our first position, basically. This is how we're going to start everything. This is going to be all of our reference. So feel free if you like. I'm a big close my eyes sort of person, but let's just take a couple nice deep breaths together. Big breath in through the nose. Big breath out through the mouth. And just slowly continue to do that. And I want us to think about what joints are allowing this to happen, specifically in the thoracic region. We've got the sternum in the front. We've got the ribs that meet the sternocostal joint right here, gliding component, right? Continue to take a nice breath in, breathe out. Gliding joints all in the front where the ribs meet the sternum. Feel that rib cage expand, feel the rib cage collapse. Now we know what's interesting about gliding joints is they don't have anything specific. We're not going to get anything like flexion or extension out of this, but we're going to allow things to happen around them. So again, continue to breathe, feel that rib cage expand, feel the rib cage collapse. Now I encourage you now to start to bring your awareness toward the back side of the ribs, where the ribs articulate with the vertebrae on the back. Remember what this is called? Costovertebral joint. Costal being ribs, vertebrae being vertebral. So we've got 12 thoracic vertebrae, the ribs articulating in there, 10 directly, 2 floating at the bottom. What's happening back there? Gliding again. What does gliding do as we continue to take our deep breaths in? It allows the rib cage to expand and collapse. So again, sternocostal in the front, gliding, costal vertebral in the back, gliding, expand and collapse at the rib cage. All right, so let's move into a more complicated joint, one of my favorite joints in the body. Let's think about the shoulder now. Comprised of 3 to 4, depending on where you look, different articulation points, right? Right up here, we're going to have where the sternum meets the clavicle, sternoclavicular, one of the 2 saddle joints in the body, right? We take the clavicle out. I even encourage you, if you don't mind, just to reach up there, find where the sternum meets the clavicle. Find that little saddle. Feel that articulation right there. As we palpate out now, just palpate laterally along the clavicle. Palpate out to where the clavicle meets and articulates with the acromion. This is going to be known as the AC joint, acromioclavicular. But then we think, what else is happening there? We move on down. We've got the ball and socket of the head of the humerus and the glenoid cavity. The old glenohumeral joint, 9 different actions available here. But then on the back side, scapulothoracic, a false joint, a joint only held in place by muscles. So let's start to first bring our awareness to the scapulothoracic. One of my favorite actions, retraction. So let's go ahead and squeeze those scapulas together in the back as much as possible. And let's just start to think about what's operating here in order to accomplish this. Middle fibers of trapezius, rhomboids are shortening and contracting. What muscles are allowing this to happen? Pec minor, serratus anterior, right? So squeeze those together, open up that chest, retraction of scapulothoracic. Now we switch, we come forward, protraction of scapulothoracic. The muscles that were shortened now become lengthened, so rhomboids and traps are lengthened now, serratus anterior, pec minor shortened. Take another nice deep breath in. Feel the rib cage expand and collapse again, gliding joints all the way, right? All right, let's go back to scapulothoracic. Now we're going to elevate. Think about elevation of the scapulothoracic. What are we talking about here? Upper fibers of trapezius, levator scap. So we think if we see someone in this posture, what's probably shortened? Those muscles, right? Now let's think about depression. Let's move the shoulders as far away from the ears as possible. Think what's happening here. What's pulling down on the scapulothoracic joint to do this? Lower fibers of traps, right? Serratus anterior again, pec minor, all shortened to create this action. And we have two final actions, right? Upward rotation of the scapulothoracic. Always like to think about a nice 80s dance video, something to this effect. What's upwardly rotating the scapulothoracic? Remember that? Two muscles, trapezius, upper and lower fibers, and serratus anterior. Now we think about downward rotation. Put that hand in the opposite back pocket. What's happening there? Rhomboids, levator scap, pec minor. Remember all those? Downward rotation of scapulothoracic. So do that other side now, upward rotation. Again, what's happening here? Trapezius, upper and lower fibers, serratus anterior. Downward rotation, everything else. Rhomboids, levator, pec minor. All right, so we've covered our gliding components. We've covered our false joint. Let's move into glenohumeral joint. 9 different actions, correct? So let's go ahead and bilaterally move into flexion. Let's move our hands bilaterally into flexion. What do we feel shortening here? What is creating flexion? Front side muscles, right? Upper fibers of pec, costovertebral. Remember that little friend in there? We could even consider biceps brachii. We could consider anterior fibers of delt. Now let's go into extension. What happens? All those that I just mentioned are being lengthened now. Posterior fibers shortened. What do we have happening here? Latissimus dorsi, right? Wherever latissimus dorsi goes, teres major follows. What else? Posterior fibers of delt. That's 2 of the 9. Let's come back to anatomical position. We'll take our nice deep breath in again. Feel those gliding joints allow the rib cage to expand and collapse. And let's go into abduction. Abduct all the way out to the side. What's happening here? This is deltoid time, right? All fibers of deltoid help here. Abduction. Let's go down to adduction now. What's happening here? How do we do that? How do we adduct? Pec major, latissimus dorsi, teres major again, right? All involved with adduction, glenohumeral. Costovertebral, just for fun. Don't forget that little guy. All right, what else do we have? Flex extend, ABAD. Medial rotate. Lateral rotate. All of the glenohumeral. Put the jacket on, take the jacket off, right? What's happening here? Medial rotation. Latissimus dorsi again, right? Subscapularis, teres major, pec major. What's happening with lateral rotation? Infraspinatus, teres minor, posterior fibers of delt, right? 2 more actions. Horizontal adduction. What's happening here again? Upper fibers of pectoralis major. Deltoid again. Horizontal abduction. Deltoid posterior fibers. Feel that action. Feel the shortening, feel the lengthening. That's 8. And if you want to join me with circumduction, just feels great. Our 9th and final action for the glenohumeral is going to be circumduction. That's the amazing part of the ball and socket. All right. So let's review what we've covered so far. So we have the gliding component then of where the ribs meet the sternum and where the ribs meet the vertebrae. We have our ball and socket component where the head of the humerus meets the glenoid cavity. We have 9 actions that we covered there. We have the scapulothoracic joint, which is 6 actions, our false joint on the back side. We're going to work our way now right down into humeral ulnar. So humeral ulnar joint, we know this is going to be our true hinge. When we think about a true hinge, 2 options. We have flexion, we have extension. True hinge, humeral ulnar, flexion, extension. So now we're moving on down. We're moving down into the forearm itself. For the forearm itself, we're talking about the radial ulnar joint. Now we move into what's known as our pivot. With our pivot category, we have the 2 actions. These are nice ones here, right? Pronation, supination. Let's go ahead and take yourself through those actions if you would. Pronate, supinate, feel the forearm, feel the radius roll over the ulna in the pivot joint. All right, so now we're moving right down to the wrists themselves. So when we get into the wrists, what are we talking about here? An ellipsoid joint, ellipsoid all the way. So we get ourselves back into anatomical position. We know actions available at the ellipsoid joint are going to be flexion, they're going to be extension, they're going to be adduction, they're going to be abduction. Let's go ahead and take yourself through those ranges of motion. The ellipsoid joint of the wrist, the radiocarpal joint itself. We flex forward. We extend posteriorly. We have ulnar deviation or adduction. We have radial deviation or abduction. All right, good. Let's go ahead and take another couple deep breaths. We've covered a lot of information here today. Every time you take that deep breath, think of those muscles that are involved with that. Think of how diaphragm, it's the big muscle that allows all this to happen actively, shortens, increases space in the thoracic cavity. And as the muscle lengthens, air comes out passively. So once again, deep breath in, feel the rib cage expand. Gliding joints all the way. Exhale, feel the ribs decrease as far as their volume is concerned. All right, let's move down into the wrist itself. Now we know we have 8 carpal bones that are going to hook up with the metacarpals. Let's move into the fingers here. So we're going metacarpal phalangeal. What is this? This is a condyloid joint all the way. What can we do here? Well, we know we can flex, we can extend, we can adduct, we can abduct. So just slowly take yourself through that. Flexion, metacarpal phalangeal. Extension, metacarpal phalangeal. Where do you feel when you flex? What muscles are shortening? Anterior, right? Deep anterior muscles for the digits. Flexor digitorum profundus, flexor digitorum superficialis. Old friends coming back, right? When we extend, what do we feel? Posterior, extensor digitorum. It's the only show in town on the backside there for the digits. All of them anyway. Now let's pull into AD or ulnar deviation. Where do you feel it shortening? Medial side, right? Flexor carpi ulnaris, extensor carpi ulnaris. Remember those friends? Let's pull back into abduction now, or radial deviation. What's happening here? Flexor carpi radialis, extensor carpi radialis, longus and brevis. Remember those, friends? Lateral muscles now, right? All right. We're down to the thumb fingers. Let's go over to the thumb. Remember the thumb. We've got our saddle all the way down here. Carpo-metacarpal of the thumb. Remember, there's going to be 5 different actions available at carpo-metacarpal. So what can we do? We take it to the pinky. We have opposition. On the way to opposition is flexion, just not all the way. We extend the thumb all the way into extension, and then we bring them together for AD, bring them apart for abduction. So again, the muscles that we know: flexor pollicis longus, extensor pollicis longus and brevis, and also abductor pollicis longus. The extensors and the abductors on the posterior aspect, flexor pollicis longus on the anterior aspect, all along the radial side. So remember, the saddle is going to be in the thumb, then it just turns in and functions as a hinge the rest of the way out. All right, so gliding joints again: sternocostal, costovertebral gliding, false joint scapulothoracic, glenohumeral's ball and socket. We move down to humeral ulnar, we have our true hinge. Radial ulnar, we have our pivot. When we think about radial carpal, we're going to have our ellipsoid joint. We move into the carpo-metacarpal, we go gliding. We move into metacarpal phalangeal, we go condyloid. And then we go interphalangeal, we go true hinge. Just flex and extend. Again, we move over to the thumb now. We go saddle at carpo-metacarpal, and then we go metacarpal phalangeal and interphalangeal of the thumb. Functions just as a hinge on both. Flex and extend. All right, so we're moving through the body. Let's go ahead and take another couple deep breaths again. Feel the rib cage expand. Feel the ribs produce more space on the inhalation. Feel the rib cage collapse upon exhalation. Take a couple more deep breaths and bring your awareness to the space between the ribs now. External intercostals assist with inhalation, right? Internal intercostals assist with exhalation. Serratus posterior superior helps elevate the ribs during inhalation. Serratus posterior superior helps depress the ribs during exhalation. So again, as we take these breaths, we can focus on diaphragm. We can focus on what's happening in that area of the body. The breath comes in, the stomach comes out. The rib cage expands. We exhale. Diaphragm pushes the air back out as it relaxes. But again, think of the space between the ribs, the intercostals. Think of the serratus posterior, superior, and inferior doing their job as well. Elevating and depressing the rib cage during those deep breaths. So let's take 2 more deep breaths together. Really appreciate the space between the ribs as that expands based on the intercostals. And as it decreases, internal intercostals for exhalation. One more large breath together in, expand, elevate, serratus posterior superior. Exhale, internal intercostals, serratus posterior inferior. All right. Couple other actions I want to review today. Temporomandibular joint. So let's move our way up to the jaw itself. Once again, we have a hinge, but a hinge with modifications. So what are our actions going to be? A great activity first thing in the morning, to press that jaw. Open that jaw as far as you can. And elevate the jaw. Modified hinge, these are the primary responsibilities, up and down. But what else can we do? Protract that jaw. Take the jaw forward. And also retract that jaw, take the jaw back. And then one final action, we've got deviation, side to side. Let's go ahead and warm that temporomandibular joint up through all 5 of those actions, get that deviation side to side, feel that synovial fluid start to warm and lubricate the joint itself. Now we're just going to work into the neck. Let's start at the top. 7 cervical vertebrae, C1 and C2, atlantoaxial, true pivot, right? The little dens on C2 poking up. C1 rotates right around it, atlantoaxial. Let's just go ahead and rotate now to our right side. Just try to take our nose right over the acromion. Feel the rotation that's led primarily from the very top of the cervical vertebrae. Take ourselves back to center and just go to the other side now. Nose over the other acromion. Feel that rotation led again primarily by the atlantoaxial joint, C1 and C2. But what else happens? C3, 4, 5, 6, and 7? Well, let's think about this. What else can we do with our neck? We can flex forward. So let's go ahead and take our mandible down to our manubrium, as I like to say. Feel the flexion in the neck and the cervical region. Cartilaginous joint on the front, right? Limited mobility, lots of strength. Backside, facet joints, a type of gliding joint, allowing things to happen. Let's extend now. Same thing. Facet on the back, cartilaginous on the front. Again, C3, 4, 5, 6, and 7 are allowing this. Let's take lateral flexion to the right side. Feel the right side shorten, the left side lengthen. Back to center. Lateral flexion to the other side. Now we've switched roles on what's lengthening and shortening. And then again, the 4th and final action at the cervical vertebral joints, rotation. So again, C1, C2, atlantoaxial is just rotation, but the rest of the cervical allow rotation, flexion, extension, and lateral flexion. All right, let's think about the rest of the vertebrae as we move down the thoracic vertebrae. So we take our deep breath in. What can we do? Even though the ribs lock it in, we can do just a little bit of flexion at the thoracic vertebrae, all the way down to the lumbar vertebrae. So let's go ahead and just create some flexion now from the cervical all the way up, all the way down to the thoracic, all the way down to the lumbar. Again, cartilaginous in the front, gliding in the rear. We have extension as well. I like to think about starting at L5 and extending each vertebrae one at a time. L4, L3, L2, L1, T12, 11, 10. There it goes, right? All the way up. Get to the neck, take your time, slowly extend that neck. Let that gliding component activate. What else can we do now? I like to call it the heavy suitcase. When you reach to one side to pick up a heavy suitcase, lateral flexion at the vertebral column. Feel that stretch. Same side shortens, opposite side lengthens. Let's do the other side. Feel those thoracic and lumbar especially are going to give through here, right? Lateral flexion. And what else can we do, folks? Let's get some rotation. Feel the rotation, right? Again, lumbar is going to be most of this. How does lumbar do most of this? Well, it doesn't have ribs locking it in place. The thoracic still gives a little bit. Lumbar is going to have a lot of this. Then we could come all the way up to the cervical and really get some good rotation. All right, folks, that is exactly what I wanted to cover today. So let's just do a quick review of what we talked about. Again, our gliding components are going to be one of the types of joints that we need to know about. Gliding is going to be where any two flat surfaces meet together, and it's not going to have any defined actions. So our examples today of gliding joints, where the ribs meet the sternum, sternocostal joint. Also on the backside where the ribs meet the vertebrae, costovertebral joints. These are all going to be gliding components. We also talked about the carpals in the wrist being gliding components, also where the carpals meet the metacarpals in the wrist. And we also just barely mentioned where the clavicle meets the acromion. That's going to be a gliding plane joint as well. We talked about ball and socket today, glenohumeral joint, one of the best, most abilities, but least stability. We talked about the false joint of the scapulothoracic on the back, our 6 actions. Don't forget upward and downward rotation. We talked about the true hinge of the humeral ulnar. We talked about the pivot of the radial ulnar. We talked about the condyloid, or excuse me, the ellipsoid joint of the radiocarpal. We talked about the saddle of the sternoclavicular and also the carpometacarpal of the thumb, the condyloid joint of the metacarpal phalangeals, and also the hinge joints of the interphalangeal today. So I'd like to thank you all very much for attending. And hope it was a nice review, and hope you all have a wonderful rest of your day.